Hi, I'm Tessa Davis. I'm one of the co-founders of Don't Forget the Bubbles, and I'm a paediatric emergency medicine consultant. We're going to look at the common question we ask ourselves in PEDS-ED, which is, how can I get this ring off this patient's finger? So you've got a patient in PEDS-ED who has a ring stuck. They don't want it to be cut off. And so we're going to talk through the ring removal trick. Now, you may have tried this before, you may not have been successful, but hopefully after talking through this procedure and listening to some useful tips, you'll feel more confident about being able to do this next time. So this patient has a ring stuck. They actually have 2 rings on their finger, but it's just one that's stuck. Take the green elastic from an oxygen mask and poke the end under the ring. So you can see we're just putting it through the one ring that's stuck. Pull it through enough so that it doesn't come out during this procedure while you're doing your wrapping and unwrapping. And ideally you want to get someone or the patient to hold on to that while you can concentrate on the rest of the procedure, otherwise it might slip out. So, and then what you want to do is to wrap round the finger. So you have to do this bit very tightly. You want to wrap from the proximal end of the finger to the distal end of the finger. You don't want to leave any spaces, so you shouldn't be seeing any skin there in between. It will be uncomfortable for the patient, so you need to give them some baseline analgesia in advance. You may want to use some Entonox or nitrous during the procedure. And you're trying to get it wrapped past the PIPJ because that knuckle is the most difficult part. It's going to be the most swollen part. You're trying to squeeze all the edema out here so that all the edema is squeezed from the proximal end right the way past the knuckle. And once you've got it wrapped, get someone else to hold the end, and then your job is to do the unwrapping. So you're going to unwrap in the opposite direction, and at the same time you're going to pull away from the patient, so you're pulling towards yourself here. Again, this will be uncomfortable for the patient. It can feel difficult to do, but you'll see that slowly the ring is moving. There may be gaps that appear, that's okay, but you'll see that you're making progress. And this part just before the knuckle is the trickiest part and the most uncomfortable part. But as you can see, they're almost done here and they're just about past the knuckle. And once you get past the knuckle, everything looks a lot better. And the procedure is a success. So here you can see they're just there, they're past the knuckle. You take the ring off and you're just going to check that the patient can move the finger. It will still look swollen, but the swelling will go down over the next few hours. So now we've talked through the procedure, here are my 3 top tips. My first tip is to use the green elastic from an adult oxygen mask, not a paediatric one. The paediatric ones you can use, but they're quite a bit shorter, and you may find you run out of elastic to use depending on the size of the patient's finger. My second tip is to make sure you wind tightly. The times when I've gone wrong in this procedure, it's not been successful, I think is because I haven't wrapped tightly enough. You really are trying to compress all the edema out of this finger, so it has to be tight, and that will be uncomfortable for the patient. Just make sure you prepare them in advance, that it will be brief, but it will be uncomfortable. And my third tip here is don't give up. The other times when I've been unsuccessful, or when I've seen unsuccessful procedures, is because people give up just at that point before success. And what I mean by that is at that part just before you've gone over the knuckle, that's the trickiest part. It's the most uncomfortable for the patient. It looks like the elastic's all unwrapped. You feel like you're not making progress, but don't give up at that point because you are moments from success. So if you keep persisting at that stage and don't give up, you will get a successful procedure. So hopefully now we've gone through the procedure. I've given you my top tips, and next time you will have success with this procedure too. Thank you.